Mr. President, this week we will be celebrating the 50th anniversary of Medicare and Medicaid. President Lyndon Baines Johnson signed it into law on July 30th, 1965. And Mr. President, I take great pride in the Medicare and Medicaid programs because it's under the Social Security Act. And as I think most of my colleagues know, we are proud in Maryland to be the headquarters for the Social Security Administration and for CMS, the Center for Medicaid and Medicare Services. That's located in the state of Maryland. The men and women who work there are doing incredible service to carry out two of the most important programs in our country, Medicare and Medicaid. So for the past 50 years, our seniors and our most vulnerable citizens have been able to rely upon these programs to provide access to affordable, high-quality health care. Let me just underscore how important Medicare is to our country. Not just our seniors, not those who also suffer, who have disabilities, but it allows them to be able to get quality health coverage, affordable care, without having to deal with the difficulties of private insurance. You know, private insurance makes money by insuring people who can make fewer claims. As you get older, your health care needs become more intense. Therefore, private insurance companies aren't exactly excited to have people who make a lot of claims in their health insurance pool. That's why we developed Medicare. We developed it so our seniors would be able to have quality coverage. Before we had Medicare, 1 out of every 2 seniors had no health insurance. We are now able to get health coverage for our seniors. Before we had Medicare, seniors laid about 56% of the cost of health care came out of their pocket. Today, that's down to 13%. So we've seen significant improvement over time. Before we had Medicare, 1 out of every 3 seniors lived in poverty. Today, that number is 1 out of 10. Every one of the indicators that we have show that Medicare, Medicaid, and Social Security have accomplished their objectives. Now we are celebrating the 50th anniversary of Medicare and Medicaid. In regards to the Medicare program, those seniors that have disabilities who qualify are allowed to have full coverage without having to worry about being discriminated against in the private insurance marketplace. In Medicaid, 33 million children are covered, more than 1 out of every 3 in our nation. And over time, we've improved these programs. The Medicaid program has been improved by the passage of the Children's Health Insurance Program, a bipartisan bill that was passed by this body, significantly improved the access to care for our children, particularly our low-income children. And now we've also improved the access to coverage through the passage of the Affordable Care Act. The Affordable Care Act has strengthened and improved Medicare and expanded Medicaid programs to cover more low-income Americans. To date, thanks to the ACA, 9.4 million Medicare beneficiaries have saved more than $15 billion on prescription drugs. In Maryland alone, our seniors have saved more than $230 million in their prescriptions. Mr. President, I'm particularly pleased that over the 50-year history of Medicare, we've changed the program, improved it, built on it over time. When it was first enacted, it was there mainly to cover seniors' needs for injuries and illnesses. It was an insurance program in case you got sick. It was an insurance program if you had an injury. Well, we've changed that focus to a wellness program to keep seniors healthy. I'm particularly proud that when I was in the House of Representatives, I authored the bill that expanded Medicare to cover preventive health care, the screening services for colorectal screenings, for mammography screenings, for diabetes screenings, for osteoporosis. Those tests were added in legislation I authored in the House of Representatives. Now, we've come a long way since then, culminating with the Affordable Care Act that eliminated all the copays for preventive health care, because today, Medicare is keeping our seniors, our disabled population healthier because they know that their preventive health care is covered and that they can detect diseases at an earlier stage and live healthier lives. Over the past 5 decades, our nation has seen incredible positive change as a result of Medicare and Medicaid programs. On the 50th anniversary of the passage of this landmark legislation, let us celebrate the progress we have made and work together to find ways to build upon that progress by further improving our nation's health care system to ensure all Americans have access to affordable, high-quality health care and are able to live healthy, productive lives. Mr. President, this is particularly true because I believe next week we're going to see an attack on women's health care issues. And I just urge my colleagues to recognize the historical discrimination that we've had against women's health care in this country. We dealt with that in the Affordable Care Act to deal with some of the historical discriminations against women. But we need to be pretty careful about this because there's going to be an attack on Planned Parenthood. Planned Parenthood is particularly important for women's health care needs. Yes, it does deal with contraceptive services. That's very important for women. But it also deals with preventive health care and screening and primary health care. So many women get their health care needs met through Planned Parenthood. So I just urge us as we celebrate the 50th anniversary of Medicare and Medicaid, as we celebrate how we've been able to continuously make progress in providing affordable, quality health care to all Americans, whether they're our seniors, our disabled population, our children, those of low income, those of groups that have been historically discriminated against, that we look to try to build upon that programs and make it even stronger, but not to weaken the programs that are available. President Johnson's Vice President, Hubert H. Humphrey, famously said that the moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. While we still have work to do, we are closer to passing that moral test because of the creation of Medicare and Medicaid 50 years ago, and more recently, the enactment of the Affordable Care Act. Let us continue to make progress so that all Americans have access to affordable, quality health care.